wanted to ask you more about kind of your real significant area of expertise, biofeedback therapy for chronic constipation, which I learned essentially everything I know about it from you. So, and you've taught a lot of gastroenterologists about this. So I wanted to see if you could talk a little bit about biofeedback therapy, sacral nerve stimulation, and even surgery, which some people entertain if they have suffered significantly from this chronic constipation.
So I think with regards to chronic constipation, in the absence of dysenergic defecation, I'm not really sure there is a role for biofeedback therapy. So in order for biofeedback to be effective, you have to show that there is some form of altered bowel behavior. And I think that is best seen in the context of a defecation disorder, such as dysenergic defecation. So initially, there was one study that suggested that biofeedback may even help chronic constipation patients, but another study by Dr. Whitehead clearly showed that that is not the case. And I don't believe that that is the case, because what I think may have happened is the first study may have inadvertently had a large group of patients with pelvic floor dysfunction. And once they got better, clearly their constipation improved by that. Because 2/3 of patients with dysenergic defecation have coexisting slow transit. So there's an overlap between the two groups. But with regards to the other interesting thing that you brought up is sacral nerve stimulation. So this is a touch and a go situation. There was a open label study in refractory patients that Dr. Cam and their group partly in Australia, but mostly in England and Europe, did up to 100 patients and showed that it was effective. It was a uncontrolled study, but they took patients who had failed all standard therapies, and then they gave them sacral nerve stimulation. But that kind of a refractory group, but open label trial, they showed that it actually helped. But since then, there have been about 2 or 3 smaller randomized controlled trials. None of them really showed that sacral nerve stimulation was effective. So I think the jury is still out on the SNS. It is not FDA approved yet in the US for sure. I think we should wait and see whether there is more solid, good data on the role of this. Now, whether other forms of neuromodulation therapy can be effective, I think, again, we need to wait and see. There is significant interest, though. I mean, there is significant interest. There is another compound. I know I'm probably going to preempt a question that you're going to ask, probably something new that there is out there. But this is under clinical trials now, where they are doing what's called as abdominal transferential current. So basically, you put 4 different pads in the abdominal wall, and you pass current from the front to the back. And where the points meet, it generates a local activity and stimulating the colon. So interferential current, that was the term I was looking for, interferential current. So there was some pilot study from Australia showing that this works. There is now a clinical study underway in the US where they're trying to see, again, this treatment is done by the patient at home. So you show them one treatment session in the office, they take this kit home, they apply the electrodes, and then they start this program. I think it goes on for about 30 minutes or so, and then they take it off, and they do it once a day or twice a day, depending on the trial. And so there is now, if you like, a new realm of treatment approaches, like vibrating capsule, interferential therapy, perhaps, or sacral neuromodulation, or non-sacral translumbar neuromodulation, etc. So we are looking at alternative to pharmacotherapy approaches for managing these patients.
Yeah, I think a lot of people may be interested in that. Definitely. Anything that you would want people to kind of take away overall?
Well, what I want people to take away is do not accept that you have to live and suffer with chronic constipation. We have a number of treatment options.
Right.
I think if we can, many times the critical step is to understand what is the mechanism or 2 or 3 mechanisms that is causing the constipation. If that can be defined, I think we can find a solution for the vast majority, not necessarily with everybody, but I think we can really find a solution and help the most majority of patients. So patients should not just give up. they should keep knocking on the doors of the doctors and make sure that they can find a treatment that works for them, that is safe and effective, and restore their normal activities of daily living.
Yeah, and I think being open with your doctor and feeling comfortable with your doctor, and while you may not be 100% improved, find those gastroenterologists who want to help you kind of navigate those symptoms and want you to feel better. That's really helpful too.
Another few things I forgot to mention, really, there are some nicer tools also that people can use. There are some apps that are available. There is the My GI Health app, which through the AGA, where patient has a lot of good resources. It tells them where are physicians who are taking care of patients with constipation problems, region by region. It also gives them some information about constipation. So I think these are very useful health apps. There are other apps that people can use to record and chronicle their symptoms. So we're just keeping a simple, instead of keeping it, everybody now everybody has a mobile phone. They all like to take it to the restroom. You may as well document what's happening in the restroom with this app. So I think it's a great way of chronicling your bowel problem, but really providing insights that can be very helpful both to the patient and to the provider.
Absolutely. Absolutely.